I am Dr. Akhiles Pal, a psychiatrist in Kolkata, practicing for last 38 years. Today we will be talking about suicide prevention. As you know, suicide is a very major public health issue. About more than 7 lakh people around the world die by suicide in a year. And for people aged 10 to 34 years, suicide is the second most leading cause of death, the first being the accident. And we shall be discussing regarding the preventable factors. But before that, I have to mention that some authorities believe that 90% of people who die by suicide, they might have some diagnosable psychiatric illness, mental illness at the time of suicide. So from the mental health aspect, suicide is a very major concern. And one thing which has to be stressed, that suicide is preventable. And this year, the slogan of suicide prevention is creating hope through action. And regarding suicide prevention, what we have to do, we have to know the risk factors, number one, recognize the warning signs, number two, and then can help prevent suicide, and we acting on the protective factors. So first, coming to risk factors, there are about 11 risk factors. Risk factors are certain events or circumstances which might increase the risk of suicide. Number one is the previous suicide attempt. This is the strongest factor. Number two, if there is a family history of suicide. As you know, most of the psychiatric illness, they have a family history, and suicide might be a symptom of the mental illnesses. And as mental illnesses runs in family, suicide may also run in family. Number three, mental illness, particularly mood disorders like depression, bipolar disorder, and schizophrenia also. Number four, alcohol and other substance misuse. Number five, relationship problem, adjustment disorder, and personality disorders, especially borderline personality disorder. It has a vulnerability to. Number six, crisis like losses, bereavement, breakup of relationship, academic failures, financial difficulties, bullying, and apprehension of crisis in upcoming times. These are another six important points. Number seven is access to lethal means like poison, arms, etc. Number eight, history of trauma or abuse. Here also the factor of borderline personality disorder comes into effect, because you know borderline personality disorder people, they have a history of abuse during their childhood. Number nine, chronic physical illness, including chronic pain. Number 10, exposure to the suicidal behavior of others. So in the media, the journalists and no one should promote the suicidal behavior of. 10, there is a gender difference. Men are 3 times more likely to kill themselves than women. These are the warnings, these are the risk factors. Now coming to warning signs. How we can understand that any particular individual might commit suicide or at the risk of committing suicide, how we can understand? These are the warning signs. There are about 8 warning signs. Like number one, often talking about or writing about death, dying, or suicide. And it has been seen that more than 1 in 5 people who die by suicide, they have previously given the indication that they want to die. that is, they have their suicidal intent, they have expressed earlier. So that could have been prevented if action was taken in due time. Number two, making comments about being hopeless, helpless, worthless. Number three, expression of having no reason for living, no sense of purpose in life, saying things like, it would be better if I was not here, like that. Number four, sudden increased alcohol and or any other drug misuse. Number five, withdrawal from friends, family, community, social institutions, reckless behavior, or more risky activities seemingly without thinking, and dramatic mood changes, and talking about being trapped or being burdened to others. These are the warning signs. And some predictive factors are also there, like if the individual has contact with healthcare providers, and if he or she has easy access and effective mental health care, and strong connections with family, friends, community, social institutions. These are the protective factors. And also, very important is, if any individual has problem solving and conflict resolution skills, they can also resolve their personal problems. And for any non-professional person, what he or she can do to prevent suicide. So if you know that some person is likely to commit suicide or has the behavior that indicates that he or she may die by suicide, what you can do? Number one, straightforward, ask them. It may seem hesitant to ask, but research shows that asking it is helpful. If you ask whether you want to kill yourself or not, straightforward you ask him or her, and so that you can know what is his or her intent. Number two, if you know that he or she is in risk of dying by suicide, keep them safe, reduce access to lethal means from dangerous places, also keep them aside. Number three, and whenever you know that he is at risk, don't leave him alone, be there with him, listen carefully and acknowledge his or her feeling. It may seem that what he or she has been saying may not be correct, but for the time being, you should acknowledge that what they are saying, this is correct, you understand their feeling, and you empathize with them, and then help them connect with mental health care provider, and so that they can get help from skilled professionals. And when the emergency is tackled, even after that, try to keep connected with him even after the crisis is over. Thank you.